day, everyone. I am Clarisse Tumacas of BSN 1B, and I will be discussing about Cecilia Laurente's theory of nursing practice and career. Before we proceed on the theory, let's first know more about the theorist herself, Cecilia Laurente.
Who is Cecilia Laurente? Cecilia Laurente is a Filipino nursing theorist who focused her works primarily on helping a patient through support systems, specifically the family.
Published a paper entitled Categorization of Nursing Activities as Observed in Medical Surgical Ward Units in Selected Government and Private Hospitals in Metro Manila. Now let's discuss Cecilia Laurente's career and educational background. And according to my source, Cecilia Laurente graduated BSN at University of the Philippines in 1967 and proceeded to a Master of Nursing in 1973. In 1968 to 1969, she worked as a staff nurse, and in 1970 to 1972, she became a head nurse and became a nursing supervisor in 1973 to 1976 at the Philippine General Hospital. She also worked at Metropolitan Hospital in Michigan, US in 1976 to 1979. In 1979, she became an instructor at the University of the Philippines College of Nursing. And in 1966 to 2002, she became a Dean of College of Nursing in UP Manila. Did you know that Cecilia Laurente was the Philippines representative on the two-day meeting held in Seoul, Korea, where there are other Asian countries' representatives who discuss a priority area in nursing research by these experts, and this was on September 16 to 17 in 1996. So in this meeting, she cited that nursing research aimed at improving basic nursing services such as the use of banana leaves to heal the cubitus ulcer, the use of music therapy and guided imagery to reduce postoperative pain, and the use of lactation amenorrhea method as natural planning to reduce the risk of pregnancy, and the health education and the home-based mother's record to improve prenatal care.
Now let's proceed on the nursing theory. Theory of nursing practice and career. The theory was from her study, the categorization of nursing activities as observed in medical surgical ward unit in selected government and private hospitals in Metro Manila, which was conducted from January to June 1987. In the recent study of Laurente, she states that the other entry point for helping the patient is through the family, when nurses can be of great assistance to prevent at the beginning serious complications. The nurse can help strengthen the family's term of knowledge, skills, and attitude through effective communication, employed informative, psychotherapeutic, modeling, behavioral, cognitive behavioral, and or hypnotic techniques are summarized and evaluated.
Now let's proceed on the concepts of the theory. Anxiety. What is anxiety? Anxiety is a mental state of fear or nervousness about what might happen. So, there are nursing caring behavior that affects a patient's anxiety. That includes the presence, the concern, and stimulation. So, in presence, it is a person-to-person contact between the client and the nurses. And the concern is the development in the time through mutual trust between the nurses and the patient. And stimulation is a nurse stimulation through words taps the powerful resources of energy of person for healing. So in Laurente's theory, we have the enhancing and predisposing factors. So firstly, what is predisposing factors? Predisposing factors are defined in this model as factors that exert their effects prior to a behavior occurring by increasing or decreasing a person or population's motivation to undertake the behavior. Under predisposing factors that affects a nursing behavior, we have the age, the sex, the civil status, the educational status, the length of work, and experience. And in enhancing factors, we have the one's caring experience, beliefs, and the attitude, feeling good about something or someone, learnings at school, what patient talks about the nurse coping mechanism to problem encountered, and lastly is the communication.
Laurente's theoretical model. We have the predisposing factors and enhancing factors. When these two is add up, it'll create the nurse caring behavior, which consists of presence, concern, and stimulation. So this nurse caring behavior will help decrease anxiety.
And that sums up our discussion on Cecilia Laurente's theory of nursing practice and career. Again, I am Maria Clarisse Q Tumacas of BSN 1D, and that is all for our discussion.